welcome Dr. Sharad. Welcome to my show, My Two Cents.
Thank you, and it's amazing being here today.
Thank you very much, sir. So today, as the topic is the cancer management in ENT, let us start from a very basic question. What is the cancer of head and neck region, and what are the symptoms of the same?
The cancers or the malignancies of the head and neck region basically compromise the cancers that happen in the ear, the nose, the throat, in also the oral cavity, which involves the buccal mucosa, the tongue, then the voice box, the laryngeal malignancies. Other than these, there are malignancies involving the salivary glands, predominantly the parotid gland, the submandibular glands, also certain glands like the thyroid and parathyroid.
Okay. And what are the symptoms for the same?
Oh, that's an elaborate thing to discuss because each side has specific symptoms.
Oh, okay.
Now, if we are dealing with oral malignancies, it is usually a patient with a small reddish looking, bleeding, painful ulcer. Okay. If it is something to do with the ears, you can see a very bad, fungating, ugly looking ulcers in the ear.
Okay.
And if it's something in the nose, it can be bleeding, nasal blockage, loss of smell because of obstruction.
Okay.
Now, if it's got something to do with the voice box, definitely you're going to have voice changes. If it's at a different side, you can have difficulty swallowing, painful swallowing. And like if it's involving the salivary glands, definitely there will be swellings in the gland. These are the most predominant symptoms that we see in the clinical practice these days.
Okay. So, doctor, if a patient has these symptoms that you just said, then who is the specialist doctor that this patient should now go to?
Now, what we must understand is the Indian subcontinent, the clinical practice is such that the patient ends up being with a general physician for the first time.
Correct.
Or a dentist.
Correct.
Okay, because these are the individuals who pick up the lesions.
Okay.
Now, it is up to these clinicians to understand the requirement of the pathology and then guide the patient to a specific specialist. Now, it can either be an ENT doctor who is specialized in oncological management, a surgical oncologist who has specific interest in head and neck malignancies, or oral dental surgeons who are trained in oral malignancies.
Okay.
There are specific malignancies in the ENT head and neck region that those are dealt mostly by the ENT surgeon because they end up picking the problems first.
Okay.
That's how it works as of now.
Okay. But what are the different treatment options available for the cancers of head neck region?
First of all, the treatment is based on correct diagnosis.
Okay.
Diagnosis and staging of the disease, if it is cancer, is very important.
Okay.
Based on your diagnosis and staging, the treatment is tailor-made for the patient. Not all patients can be given A, B, C because there is a component of the age, other risk factors involved, monetary issues because cancer treatments are not easy in this country.
Yes.
So based on which we as clinicians have to find the best way to manage the issue. So it can vary from simple chemotherapy with radiation therapy that is done in adjunct with surgical management. If the disease is it's a huge disease. If it is a disease that can be contained just with surgery, and that's all that is to be done with it. But what is more important in treatment of such malignancies is the importance of functional and aesthetic rehabilitation.
Okay.
When it comes to, it's not about just removing a part of the tumor or part of your organ. It's about to get the patient back to his or her functional capability or optimal functional capability.
Correct.
But so that is where the importance of a speech swallowing therapist, a physiotherapist, a nutritionist, we all have to work in tandem to get things sorted for a patient.
Okay. So Dr. Sharad, once the treatment is done, So how long is the follow-up required, and how important it is for for the patient to come for the follow-up appointments?
After the surgical treatment, it is mandatory that we see the patient every 3 months for the first 2 years.
Okay.
Then every 6 months for the next 2 years, and then annually beyond which.
Okay.
So this is important, but if there is anything that pops up in between, pain, swelling, a sudden increase in pain in that particular area, then these are red flags that the patients need to bring up to the patient doctor.
Okay. Yeah, thank you, Dr. Sharad. Thanks for making it so easy for all of us to understand the cancer of the head and neck region. But before you leave, I want you to tell us your 2 cents for the upcoming ENT surgeons who want to pursue their career in head and neck surgery.
That's a big question. See, when I started as an ENT surgeon, it was my teachers who guided me to take up head and neck surgery. It requires a lot of passion, a lot of standing hours. It's not going to be like your routine ENT practice where you operate for an hour and you're done with. You might end up standing for hours and hours. So that's the most important thing, that you need to have the zeal to do it. But if you were to ask me those 2 cents, I would say, first of all, you need to know what kind of practice you want to lead. If you are in to have a private practice and want to solely keep everything to yourself, then you must be doubly careful that you might be on the losing side, because this is all about teamwork. You need a bunch of people around, asking questions, replying to them, getting their work done together, consolidating each thing for the patient. So it is tireless work. And one patient might take a long time. It's never going to be diagnosis in 5 minutes and you end of it. That's what we do in most of our ENT cases, because the diagnosis is there. It's either perforation or some secretion, some allergic fungus somewhere. But malignancies, from day one, your patients will take a lot of time. And yes, such patients require your patience. Number 2, everywhere, in every game of medical science, the teamwork. It is always teamwork. If there is no teamwork, we fail. Correspondence is important among your peers, among the patients, patient relatives. That is what I think makes us do what we do best.
Okay. Thank you very much. Thank you, Dr. Sharad, for your time.
Thank you so much for having me here.